This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit americanmobile.com to get started. So what does the nurse normally do in those procedures? Like, what are you responsible for doing?
Yeah, so one of the big changes we've had over the last year is we moved away from conscious sedation, which used to be nurse administered, like fentanyl, Versed sedation. We moved to all propofol administered by CRNAs. So that used to be a role the nurses would perform, would be administering meds. But now they moved more into what's called a circulating nurse role. They're doing a lot of charting and documenting of what's happening during the procedure. They're also helping back the tech if they need additional equipment that maybe isn't in the room, or grabbing them things. And then the CRNA, they're helping them with their turnover. So cleaning their equipment off, changing their suction, they're wasting the propofol medication after the procedure. So just helping things run more efficiently. And then the tech is, helping man the scope and the equipment. So that's typically how it goes. In our therapeutic rooms, we have 2 nurses assisting the doctor, and they essentially alternate in those roles. Okay. But if you're the nurse that is acting as a tech, you're assisting the physician. So you're handing him the tools he needs, whereas the second nurse is grabbing you things that you'll need to perform that task. They use a lot more equipment in those rooms. So it's nice when you're actually, handing a physician a wire, they're having you inject contrast or inflate a balloon. They might want to dilate after that. And your other nurse is like setting that all up for you so that you're able to just switch out the equipment and hand the next equipment. So just helping with efficiency. It is nice to have 2 people in the room to help with those things.
Yeah. So you probably have to learn all of these different types of procedures and in preparation for like what they're going to need and stuff.
For sure. Yeah. It's a whole new realm. And it's not something that you would typically come in knowing unless you had prior endoscopy experience. And with everything that had happened with COVID, we lost probably about 50% of our staff, whether they left nursing altogether, moved home to be closer to family, changed career paths to do something else that they want to do. I mean, a lot of people saw people making big changes. And so trying to get our staff all retrained and up to what expectations are it's challenging because I would say the only place that nurses really come in feeling comfortable or feel like they understand or know from prior experience is typically our recovery area. You're used to that interaction with patients. You can learn what you can and cannot give the patient based off of your orders or asking another fellow nurse. But the rest of the area is brand new for everyone. And I don't know, I think that's what makes it exciting too.